So again, thanks for all of you for accepting this invitation and attending this meeting. This meeting, inshallah, we will talk about MRCOG Part 2 exam and how we can prepare for it. This session is mainly designed for doctors going to have the exam in January 2025, but it's also suitable for anybody having any exam based upon the UK, British, or RCOG guidelines, whatever in January or even sooner or later. Okay, but mainly this is for Jan 2025 exam. This is batch number 16 of this course. I started this course in year 2016. So now 8 years, alhamdulillah. We helped hundreds of doctors to get the membership of the Real College. So this is our main target, Jan 2025, MRCOG Part 2 candidates. This is me. My name is Dr. Osama Akl. I am MRCOG member, and I am RCOG examiner and instructor also in Part 3. So I am trainer, and also I have participant of America from Harvard Medical School called Teaching to Trainers. Also, I have the Egyptian Fellowship, British Society of Gynae Endoscopy Level 1, Birmingham IVF diploma, and also a diploma in endoscopy from Egypt and Germany. So this is my hospital. I used to work last year in UK, very lovely place, and I had the honor to work for NHS. It was very lovely time in this very lovely hospital, and it helped me much in my teaching that I was already working for NHS. So many of the things I say are coming from my background and my experience in NHS. So already all of you passed already MRCOG exam part 1, and I think it was not so difficult. Somehow part 1 is an easy step. Okay, part 3 also is not very difficult. Always part 2 is the one which is more challenging, because part 2, it needs hard work. And actually, the sources for studying part 2 are too many, okay, including NICE guideline, the Green Top guidelines made by the Royal College. Also, we have guidelines made by PASH, others made by Faculty of Sexual and Reproductive Health, others made by BHIVA, and we have many talk articles. Okay, and talk articles are an endless source of knowledge. So we have 4 issues every year, so 1 issue every 3 months, and every issue contains about from 7 to 10 reviews. They are important, and in the exam, usually the strange questions are coming from the talk articles. They are not strange, but already, as we said, talk articles are endless sources of knowledge. So part 2 is the most challenging one. It needs a very good preparation. If you pass part 2 while you didn't study very well, you have a problem in part 3. Because in part 3, we say part 3 exam is not based upon knowledge, because we assume that all candidates passed the part 2 with very good solid knowledge. So if you pass the part 2 without studying hard, you will have another problem in part 3. That's why let's prepare for part 2 very well, for many reasons. One of them, to be ready for part 3, and already you are considered that you covered already as a part of the knowledge. Also for your practice. I think for all of us, studying for MRCOG part 2 is the main studying we study as postgraduate. So we don't study the same extensive studying, whatever for diploma, for master degree, but for MRCOG, it's hard studying. That's why it will make you an updated doctor with solid knowledge coming from all these sources of knowledge we have said. So take it serious, prepare very well for part 2, because you are building yourself, you are building your career. So don't take it just I want to study to pass the exam. No, no, no. You have many other benefits. Okay, believe me, if you compare between two doctors, one studied very well for part two, another one didn't study very well, and both of them were lucky to pass. The one who studied well versus the another one who didn't study well. The one who didn't study well, I think he is in a difficult situation because now his colleagues and other doctors in the department are speaking to him as if he has very good knowledge. But unfortunately, he didn't that so much. So please take it serious because you will be more responsible in your department if you are a member of the Royal College. The colleagues will come to ask you, assuming that you have the enough knowledge. So you have to be responsible enough. So let's take it very serious for part two exam. And you can consider this, this will be the last very hard studying in your life. After that part three, it's a matter of some techniques and some skills and more training, more than reading and knowing knowledge. So take it serious. MRCOG exam generally is a basic exam in UK. So if you are a trainee and you are ST6 or ST7, already you have MRCOG. Okay, it's a routine step. Because to pass from ST2 to ST3, you should pass part 1 MRCOG. And to shift from ST5 to ST6, also you passed part 2 and part 3 exam. So all ST6 already they passed MRCOG part 3. After finishing the 7 years of training, you will receive a certificate called Certificate of Completion of Training. So you can start in the advanced training subspecialty modules to be consultant in a specific specialty. Okay, like laparoscopy, endoscopy, gynae oncology, urogyne, and others. So this exam, MRCOG part 2, it needs hard working. And after going to the exam, you will return as somebody with solid knowledge. Already you will be different body. If we say that studying for part 2 will take 6 months, in the first 3 months, you are studying as much as you can. And in the last 3 months, you are studying very hard in these last 3 months before the exam. So you will be somebody different after these 6 months of studying for this exam. Please don't walk in this way alone. This way alone is difficult. Not talking about courses, talking about study partners. You need study partner. If you don't have somebody to study with, you need from today to have somebody to study with. So everybody of you will help the other. You will encourage each other. This way is not good, not easy if you are walking in this way alone. And one of the good things we get from studying for MRCOG, making good study partners, you will become friends and maybe friends forever. You will pass together part 2, then you will pass together part 3, then you will go together to the ceremony in their college to get the certificate of the membership. So far on the RCOG website, they didn't write the timetable for preparing for January exam. So we'll take the data from July exam, the one which will be just after about 11 days. So please pray for our colleagues and the candidates going to have the exam in 3rd of July. So just after 11 days, Allah be with them all. So already they did what's called expression of interest, which is a form on the RCOG website. You write your email, you write your name, and they will understand that you are planning for the coming exam, which is July. So also all of you will need to apply expression of interest, so you can apply for January 2025 exam. After doing this expression of interest, later, when booking for the exam starts, the college will send you an email. So you can pay for the exam because already you made before an expression of interest. So let's take the timetable of January because somehow it will be nearly the same like the one for the coming exam. I know this one from the last year. because until now, just an hour ago, the college didn't write the timetable for January exam. Okay, so we will learn from the last year. So booking will start in November and booking will close in December. So booking will take 1 month. But I recommend that you book for the exam in the first minute. You know, the exam now is computer-based exam. It's one of person view centers. And too many candidates are planning to take this exam, but the seats are limited. That's why book in the first minute. So I assume all of you will book in the first minute of booking when the application starts. And the results are about 1 month after the exam itself. Okay, this is how the expression of interest on RCOG website looks like. You will write here your college number, your email address, first name, family name, and confirm that, and security check. Some doctors can have some problems with this security check. It's like a batcha. It's like a code. If you don't see it well, okay, please try another browser until you can see it. If not appearing on your mobile, try from your laptop or PC until you find it, because sometimes the browser itself will prevent this captcha from appearing. Then you press submit. They will give you a message, thank you. You will not receive an email that you did expression of interest. Just when you press submit, thank you, finished, that's it. This is how the exam looks like in person view centers. Every candidate sitting in front of a computer. Whenever you come to the exam center, you sit to the computer, they will start the exam for you. And you will start with question number 1, then next number 2, 3, 4, and so on. As you know, MRCOG part exam, same like part 1, made of 2 sessions, but there are some differences. In part 1 exam, in every session you had 100 questions, all of them single best answer. In how many minutes? 2 hours and a half. So 150 minutes. This is not the same in part 2. In part 2, also you have 100 questions in every session, but 50 of them single best answer and 50 of them EMQs. EMQs. And these EMQs are one of the causes that MRCOG part exam is challenging. Because when you are solving single best answer, let's say you don't know this question, you don't know its answer at all, but you have 5 options. So already there is 20% chance of luck that you solve the question by luck. While in EMQs, okay, you can have 20 options, 25 options, more or less. So already the chance of luck becomes very small. That's why EMQs are challenging. Many doctors say, doctor, EMQs are difficult. Yes, that's why the college made the exam 50% single best answer, 50% EMQs. Okay, 50%, I mean the number of questions. Do you know that EMQs have 60% of the marks, while single best answer 40%? It's another challenge that EMQs, they take 60% of the mark. Okay, so we try as possible to have training for EMQ question solving. And actually, EMQs, I say that they investigate your deep studying, not superficial studying. The chance of luck in solving it is very low. So it's either you studied or not. Okay, and not superficial studying, not reading once. They assess your deep studying. That's why they are difficult. That's why they are challenging. Okay, if you are comparing driving a car versus driving an aeroplane is difficult, but it's an aeroplane. Don't tell me let's make driving aeroplane seem like driving a car. At the end, driving a car is much easier than driving a plane, even with training. Okay, because it's not that easy. They don't have the same challenges, not the same conditions. So if you study well, deep studying, okay, you can solve EMQs. The cost of the exam, if you are present in UK or Ireland, you will pay 534 sterling pounds. If you are living in Band A country, this is what you will pay. In Band B, this is what you will pay. In Band C, this is what you will pay. I think you are familiar with these bands already from part 1 exam. So this is depending upon in which country you are planning to take the exam. So if you are planning to take it in Egypt, you will pay 555. If planning to have the exam in UK, you will pay 534 as an example. And on the RCG website, there is a table for Band A countries, Band B, and Band C. It's made according to the financial status of every country. The rich countries will be in Band A, and not rich countries or low-income countries will be in Band C, intermediate B. So we have 2 sessions, session 1, session 2, every one 3 hours, and every session there are 100 questions. 50 questions, single best answer, and 50 questions EMQs. And EMQs, they have 60% of the marks. Single best answer, they have 40% of the marks. So if we make it like this, that there are 180 minutes. In them, we need to solve 50 EMQ and 50 single best answer. I recommend that every EMQ takes 2 minutes. So 50 multiplied by 2 minutes. So here we have 100 minutes. And every single best answer takes 1 minute. So total 50 minutes. So overall, 150. You have already the remaining 30 minutes for revision and solving unsolved questions. Because if you find, for example, question number 7, it's difficult. I don't know it. Okay, skip it. Go to number 8. Difficult, skip it. Go to number 9. Believe me, after finishing most of the exam, even if you left 20 questions, no problem. You will find that they became easier. Your anxiety, your stress became much less at the end of the exam because already you know that you solved most of the exam. And solving some questions can help you to solve others. For example, you are solving an EMQ about DVT, and it's difficult. In one of the single best answers, one of them talking about DVT, that the patient came to the hospital complaining from so-and-so, and they did compression duplex ultrasound, which showed so-and-so. So they are telling you that when you suspect DVT, do compression duplex ultrasound. You can use it to solve the EMQ about DVT. So some questions can help you to solve others. So this is my time strategy for the exam. And in between, there is a break about 60 minutes. It's not lunch break. It's just a break because they don't give you lunch. Okay? So they never give you lunch. Even in the exam, they give you like a pen and a tablet. Okay? It's a board like tablet, or we can say electronic board. So you can use it if you want to, for example, draw something to help you to solve a question or to do some calculations for statistics numbers. And of course, they take it from you. Okay. How many times you can attempt part 2 exam? Candidates will be permitted no more than 6 attempts at each of part 1 and part 2. But don't worry, this is for doctors who are in the training system. What if you are not in the training system, like most of us, not in the training system? Candidates not wishing to enter UK specialist register, you have unlimited number of attempts. Okay, so there is no upper limit. So you will try until you get part 2. Maybe, inshallah, if you study hard, you can get it from first trial. If you couldn't get it from first, you can get it from second. There is no upper limit. Okay? So these are the number of trials. It's unlimited if you are not in the training program. If you are in the training program, no more than 6 trials. how long you can wait after finishing part 1 so you can join part 2 exam. If you are in that training, within 7 years. If you are not in the training, 10 years. Doctors who passed part 1 in or before March 2013 need to attend part 2 within 10 years of their exam. If you pass part 2, candidates who have passed the part 2 need to attend part 3 within 7 years. This is between part 2 and part 3. And one of the good news that they don't count the 2 years of the COVID. So actually, they made it 12, not 10. Okay, so as you see in the coming slides, okay, that they sent to doctors that don't worry, the 2 years of the pandemic are not counted. So maximum number of years now between part 1 and part 2 is 12 years. I advise that once you finish part 1, within 1 or 2 years, maximum 3, let's say, go and join part 2 exam. Okay, no need to delay between part 1 and part 2. Some doctors already fell in this problem that they found themselves, there is 8 or 9 or 10 years between part 1 and part 2. Why? Go and at least have the trial once. If you try part 2 once, now you break this time limit. You don't have time limit now. Some doctors can have many years between first trial in part 2 and second trial. No problem. Already they broke the time limit with trying the exam once. So please don't delay much joining the exam after part 1. As I told you, we started these courses since year 2016, and this is batch number 16. MashaAllah, many doctors. This was the first group in July 2017, started at early 2017. MashaAllah, many doctors passed, they became members, and this is for another exam, MashaAllah, from many countries, including Arabian, non-Arabian countries, worldwide, let's say. Okay, another exam. Okay, I used to make very good congratulations for them on Facebook. So what is our course made of? And how we can prepare if we don't want to join any courses? Let me say the 2 scenarios. Our course is made at the beginning from what's called long course. What is a long course? They are 40 online meetings every Friday and Tuesday. Friday usually at 8 a.m. UK time, and Tuesday at 12 p.m. UK time. Some variations will be in the winter time against the summer time. Nowadays, already we are at 8 a.m. and 12 p.m. on Tuesday. In these 40 meetings, we discuss everything. Nice, green top articles from any source, even a National Health Society cervical screening program, behavior, any source. We discuss it here in these meetings. Every meeting, it's a duration about 4 to 5 hours. Of course, there are small breaks in between. With these meetings, you don't need to open any guideline or any talk article. All you need, you will study from our library, which includes the video recordings and the PowerPoint of the meeting. So, same like what we will do today. After finishing this meeting, this PowerPoint I am explaining now, and its video recording will be present on the website for the course members. Twice weekly exams. Okay, because every topic, it has its own quiz. So after having every meeting, you need to go to the website, you will study the topic, whatever from the PowerPoint or the videos, whatever you like, then you will need to solve the mock test. And the mock test will tell you what is your score. So you need to get score more than 80%. I believe if for every topic you solve it, it's mock on the website, and you achieve score more than 80%, inshallah, after finishing the course, you will get more than 80% in the exam. Because already these quizzes are made from exam questions and other sources. So you don't need any other material. So don't worry about any guidelines. You don't need anything about that. And in the last months before the exam, there is the crash course. In the crash course, it will be more condensed, more summarized. So from every topic, we explain what are the most important slides, and we solve many questions. Hundreds of questions are solved here, and also hundreds of recalls questions. And this crash course also is considered training for your patience and your tolerability in the exam. Because nowadays we are still in the crash course for the group going for July exam. For example, we had a meeting starting at 8 a.m. UK time and finished at 9:30 UK time. There is something missing in this. What is it? This 1 a.m. and this 1 p.m. So 13 hours and a half meeting. Okay, we do this every Friday and every Tuesday. Okay, the time ranges from 12 to 13 hours meetings. We are together on Zoom from early morning until the night. Okay, we go to sleep, then few days later, again, we do the same. So, and mashallah, I am happy that doctors are telling me until the last moment, we are not feeling fatigue. It's very interesting. We can even continue longer if you want. This is considered training before the exam, because the exam, as we see, it's made of 6 hours. So 6 hours you are sitting in front of the PC solving the exam. There is 1 hour break, so even we can say total 7 hours. So already you are trained on the crash course to stand or sit in front of computer studying and learning these long hours. So I consider it also training for the long hours of the exam itself. So all what you need, you will attend the meetings and you will study from the website. You will solve the quizzes on the website. You will see the videos, the PowerPoint. They are available in your account until the exam in January, inshallah. And from the first day, your account on the website, it contains everything. So, for example, the group I am still in now, which is batch number 15, okay, their website, it contains the material recorded from January 2024 until June 2024. All of these materials are present already from day 1 in batch 16. And some doctors in batch 16, the new one, they asked me, Dr. Osama, please, we need to be regular day by day. Can you make it for us that at starting the course, our website is empty, and after every meeting, you add its material? Okay, I will make 2 options available. Even I can make 2 things present, that you can have access to 2 courses on the website. One of them containing all the material from day 1, and another one, it will be empty at day 1, and after every meeting, we upload its material. So whatever you are happy with. Because some doctors, they don't like that from day 1, they open the website, they found big library of topics. No, we need it to be empty. Then we walk step by step. Okay, whatever you are happy with, we can do both. Okay. These are the timing of the meetings. Okay, it's variable, summertime, winter time, but I told you now we are in Friday, 8 a.m. UK time, Tuesday, 12 p.m. UK time. This is a list of the topics of the long course: systemic lupus, phenylketonuria, diabetes, DKA, early pregnancy problems, including ectopic, molar, pregnancy unknown location, miscarriage, hypertensive disorders, maternal collapse, ACGA, recurrent pregnancy loss, cord prolapse, obstetric cholestasis or ICP, thrombocytopenia, anti-RBCs antibodies, cardiac diseases in pregnancy. It's a full day, including congenital and acquired heart diseases. Also talking about arrhythmias, peripartum cardiomyopathy, and talking about cardiac transplantation, even talking about prosthetic valve, everything about cardiac disease. Preterm labor, psychiatric disorders, neurological disorders, including headache, epilepsy, facial palsy, and others. Breech presentation, external cephalic version, nerve injury, whatever, in gynecology and obstetrics, because we have to talk articles about this topic. GBS, which is strep agalacti in pregnancy. Intrapartum care, it's a very big day. Okay, talking about first stage, second stage, instrumental delivery, inner sphincter injuries, and talking about CTG, how to interpret, because in the exam, you can have a scenario about CTG and you need to interpret and see what will be the next step. Cesarean section, vaginal birth after cesarean, Ogilvie syndrome, thromboprophylaxis, thromboembolism, ovarian vein thrombosis, breast cancer in pregnancy, bronchial asthma in pregnancy, appendicitis in pregnancy, multiple pregnancy, skin eruptions, renal diseases, liquor abnormalities, amniocentesis, hemoglobinopathy, which are thalassemia and sickle cell disease, antepartum hemorrhage, placenta previa, morbidly adferent placenta, postpartum hemorrhage, intrauterine fetal death, abortion care, reduced fetal kicks, induction of labor, abdominal incisions, TOGs from different years, antenatal care, teaching, methodology, thyroid disorders in pregnancy, infertility, its full day, including talking about NICE guidelines of fertility, including the Green TOG guideline about OHSS, including TOGs about polycystic ovary syndrome, and Green TOG guideline about long-term complications of polycystic ovary syndrome. Contraception in 2 days, because we explain everything in details. Okay, I believe we as gynecologists, we have problems in studying contraception. And we hardly open a book or open a guideline to study contraception without exams. If I ask among us who opened a book to study contraceptions without having an exam and without having a patient that you are opening the book so you know what will be the management of this patient, I don't think that we do that. So it's a good chance that we know everything about it. Female genital mutilation, menopause, and HRT. Ovarian cyst, whatever, in adolescence, in non-menopausal, menopausal, and in pregnancy. Infections in gynecology and infections in obstetrics, including syphilis, CMV, rubella, toxoplasmosis, HIV, Zika virus, malaria, and many others. Pelvic organ prolapse, laparoscopy, urogyne, it's a full day, including talking about incontinence, urodynamics, interpretation, urine retention, Fowler syndrome, bladder pain syndrome, endometriosis, and also including talking about endometriosis and the pregnancy. What is the effect of endometriosis on pregnancy? Because some pregnancies will be considered high risk if there are advanced degrees of endometriosis. Also talking about antenatal care in pregnant woman with endometriosis. Another talk about endometriosis and fertility. Inflammatory bowel disease, irritable bowel syndrome, endometrial hyperplasia, cancer cervix and cervical screening program, endometrial cancer, obesity, ethics, medical ethics, social factors, hysteroscopy, abnormal bleeding, including heavy menstrual bleeding, intermenstrual, postmenopausal, postcoital bleeding with HRT, endometrial ablation, uterine artery embolization, all these details, sexual abuse, governance, vulval disorders, ovarian cancer, ergonomics in laparoscopy, sepsis, whatever sepsis in pregnancy or postpartum, postmenopausal bleeding, thyroid and infertility, and there is also thyroid and pregnancy, and medical statistics. All these topics, okay, and even more because this list is an old one. So all these topics and more are present in the course. In the crash course, we take summary from everything in the previous slides, like present here, and even some extra topics. Because sometimes after explaining a topic, because our course takes 6 months, sometimes we explain a topic in first month. Next month, the RCOG makes an update, or a new talk article is published about the same topic. Already, talk articles are implemented and integrated in the course material. For example, when we talk about cardiac diseases in pregnancy, there is no guideline actually about cardiac diseases. So this lecture is made of all talks related to the topic. There is talk about congenital heart disease in pregnancy, another one acquired heart disease in pregnancy, another one arrhythmia in pregnancy, another one peripartum cardiomyopathy, and so on. So don't tell me where is the talk. The talks are implemented because it's not logic that I explained today the green top guideline about sickle cell, and another day the talk about sickle cell. How come? So which one to follow? So they have to be like this. They are mixed in one lecture. And sometimes you can find that the guideline saying specific recommendation, the talk saying slightly different recommendations. So when I explain everything in one meeting, I tell you what, if there is any difference between them and how to solve that in the exam. Okay, this is an example from our website. Okay, so for example, let's have a trial. Okay, this is how the website looks like. After doing sign in, you will open your account from profile here. You will find that there is one or two courses you are involved in, not many. This is a trial account. Okay, let's try, for example, the crash course. For example, this one. Okay, for example, this was the last topic we opened here. It was abnormal uterine bleeding lecture. So this is a PowerPoint. Of course, you can make it full screen from here. Okay, and you can watch the slides. For example, this is a lecture about abnormal uterine bleeding. At the beginning of the presentation, you will find that I put screenshots of what guidelines or talk articles are involved in this topic. For example, this is the one about abnormal uterine bleeding. Okay, so you will find it's made of a nice guideline, heavy menstrual bleeding, talk about surgical management of heavy menstrual bleeding, part 1 and part 2, two talk articles, pregnancy outcome after UE, management of postmenopausal bleeding, unscheduled bleeding with HRT, talk about detecting endometrial cancer, talk about heavy menstrual bleeding in adolescents. So all of these talks and guidelines are involved into this PowerPoint. And I want to go to the end of this PowerPoint. Okay, at the end, you will find questions about this topic. So you will find a single best answer and EMQs, and you will find the answer for everyone. And sometimes you can find details about the answer if there is an evidence behind this answer. Okay, for example, this is a PowerPoint about heavy menstrual bleeding. This website is accessible, whatever from the mobile, laptop, PC, whatever your mobile is Android or iPhone. Okay, we recommend using browsers like Google Chrome or Firefox Brave. Okay, we don't recommend the Safari. It has things with its compatibility as always Apple products. And from here also, this button here on the upper left corner, okay, you can change the topic if you want. For example, you can watch the video, for example, here, like this one. I will allow the sound. So in this lecture, we will talk about multiple forms of abnormal bleeding, including heavy menstrual bleeding, causes of palmocoin. It's a lecture. Okay, fibroids is the most important one, 20 to the age of 16 and 17. Is there still active bleeding? Okay, you'll find the lecture is divided into small multiple videos, so easily you can finish first one, second one. At the end, you will solve the quiz about it. So this is a quiz. Okay, after solving it, you get a score and you will know what are the right answers. So you can know which questions you didn't solve well. And here, for example, this is a lecture recorded in 4th of June, so about 18 days ago. Okay, this is its PowerPoint and all videos of the day. They were 16 videos, mashallah, in one day. Every one of them about half an hour, 25 to 30 minutes usually. You know what you are going to say to the patient? Okay, so this is how the website looks like. Okay, and this is a feedback from doctors in the previous courses. Okay, whatever as WhatsApp messages or whatever any other form. Sorry, it's in Arabic. One of the feedback. Feedback even after the candidates coming out from the exam immediately. Okay, so please, anybody has any question about preparing for the exam or any question about our course except financial, you can ask me please on WhatsApp after the meeting. But any question about the preparing for part 2 about the exam, you may open your mic if you want. You are allowed to open the mic if you have any question about MRCOG part 2. Dr. Annaim? No questions?
Excuse me, doctor. This is Dr. Gussoon.
Hello, to
Thank you very much. Yeah, I'm fine. Thank you. Thank you very much for this introduction. I was just wondering regarding the timing of the lectures. I don't know if it's fixed or there is any chance that there will be like, because to be honest, it will not be suitable for me, like 8 a.m. at Friday and 12 a.m. at Tuesday. So are there any weekends lectures?
Okay, the timing, as you said, it's Friday at 8 a.m. UK time and Tuesday 12 p.m. UK time. You are working in Ireland, right?
Yeah, I'm working in Ireland, yes.
Yeah, okay. You may adjust your timing, for example, like doing some swaps. Okay, I used to give this course
I would
even.
really appreciate it. If it was like after 7 p.m., if it's okay, and weekends, that will be suitable for me.
Okay, I worked for NHS, and in spite of working for NHS, I used to give the lectures in the same timing. How to do that? I made swaps. I arranged my timing. Okay, also I was working full time for NHS. Okay, but in spite of this, you can change, you can adjust.
Yeah, thank you very much. I would appreciate it. Thank you.
Okay, and I know that not all doctors will be able to attend on Zoom 100% of the meetings. Of course, this is logic and this is accepted. Whatever we can do, all of us have duties. Okay, but no problem if you miss a meeting or more. Once we finish the meeting, we upload the PowerPoint and video. So you can watch
I do
yeah,
understand. Yeah, of course.
yeah,
The
sure,
thing is that I would like to attend as much as possible.
sure,
So
sure.
probably if I would readjust the timing, maybe I would miss one or two, but the rest I'll be able to attend. But in this schedule, I will not be able to attend at all. You understand me? Because I'm, in the hospital in situations and shortage of doctors, so we are in
Okay,
full time now. Okay,
so
so if you can just swap me, and if it's not possible, it's okay. I don't understand. No problem.
yeah, think of making some swaps because we are in this schedule Friday and Tuesday since 2017, so since 7 years. Try to make some swaps. You'll be able to make some for sure, as long as all our colleagues sometimes they ask us to make swaps. If you accept, okay, when you ask for a swap, they will accept too.
Yeah, it's okay. Thank you. Thank you very
Of
much,
course,
Doctor.
you
Thank you.
accepted before doing swaps with your colleagues when they ask it, or you don't accept that.
No, I haven't actually. I haven't received any request for any swap, so I have no problem.
Excellent.
I'm very
So we will be
flexible.
pioneer
Yeah,
in this
for
point.
yeah.
We
I
will
have,
be the first to ask.
yeah. Thank you. Thank you.
Yeah, thank you. And even at work, not in all shifts in the hospital, you're always busy. Sometimes you are available, so you can open the internet and listen to the video live while we are in the meeting. Okay, but if you are busy, of course, the only way is that you can watch the video just after finishing the meeting. And whenever you watch the video and you have a question, something not in clear in the explanation, I will be more than I will be more happy to accept your question on WhatsApp and explain it to you again. Sometimes even for doctors speaking Arabic, when they ask me that, doctor, this part in the explanation was not so clear for me, I can explain even in Arabic. Do you speak Arabic soon? I think you.
أيوة دكتور، طبعا
Yeah,
أتكلم عربي.
okay. Where are you from?
أنا من العراق.
Yeah, welcome. Welcome, nice.
Thank you.
Yeah, okay, thank you. Any other question? Dr. Doha asking, the course is divided into modules like gynecology, infertility, urogyny. Infertility, it has one full day. It's containing everything about infertility. Urogyny, it has one day including everything about urogyny. Gynecology, it's very big. Okay, it has many lectures about gynecology itself. Dr. Doha, I believe what will not help in passing the exam is not useful. I mean that the college is dividing the exam into 14 modules. Okay, big modules will have many questions. Small modules will have less number of questions. They don't participate by the same number of questions. So already big lectures will have many questions. Small lectures will have small number of questions. Okay, if can you tell me how this will help in passing the exam? If you have a strategy behind being divided into modules? Hmm. Is there a reason or any uh, benefit behind dividing your studying into modules? So how you use it? Can you tell me if you don't mind? If you are available and you can reply. If you don't, no problem. Okay, so this is my preferred uh, classification. Okay, I cannot classify into modules. I classify over 40 meetings. 40 meetings. When the course starts. So the current group will have the exam in 3rd of July. Okay, next week after the exam, we will start, inshallah, the new group. So I am not classifying the course into module. I classify it into 40 days, 40 scientific days. Okay, but my classification, I collect everything about contraception together, everything about urogyne together, and so on. Okay, any question?